Welcome back to another episode of Your Daily Dose by SMCV. Today we have with us our consultant neurosurgeon, Dr. Gerard Arvind Martin, who's here to share with us some advice for neurosurgical patients during this NCO period. So, Dr. Gerard, after neurosurgical procedures, it is advised for clinical follow-ups. Is it still necessary during this MCO period?
For patients who've had recent neurosurgery procedures, whether it's cranium or whether it's spine, yes, it is important for them to still continue with their clinical follow-ups. Now, for those cases that are deemed low risk, cases that the surgeon has decided that these cases can be seen at a later date, they may communicate with the surgeon, with the clinic, and have their dates postponed. Their clinic follow-ups can be had at a later date, especially after this period of MCO is restricted time.
So for patients who are in the lower risk side, it's okay to postpone it? Yeah.
Yes, the surgeon can get in touch with these patients. Alternatively, the patients can also contact the clinic and set their appointment at a later date when it's safer to come over to the clinic. And for those patients who come to the clinic, who have their appointments scheduled during this period of MCO, it's important to keep their visitors to only themselves and not to have any accompanying visitors when they come and see the doctor at the clinic. So we would want to avoid unnecessary exposure, especially when patients come to see the doctor in the clinic.
Okay. So what about patients with flu-like symptoms? Is it still okay for them to continue with their neurosurgical medication?
Now, for patients with flu-like symptoms, first of all, it's imperative and we need to emphasize that those patients who have flu symptoms, that they present themselves to the relevant health authorities, to the hospital, to have themselves checked, confirmed, and if necessary, to be treated. Now, for those patients who have been categorized as low risk and that they may self-quarantine themselves during the time period when they are still otherwise having their flu symptoms, however mild it may be, it's important that they continue with their medications prescribed by the surgeon. And this is particularly so with anti-seizure medications. The reason being is that during this period, the body undergoes some amount of stress that would put them at risk, that would make them render them more susceptible towards having a seizure. And that is something that patients do not want. Doctors do not want. And certainly the hospitals being overburdened as they already are, they don't want to see unnecessary admissions, especially during this time.
Mm-hmm.
So medications, especially anti-seizure medications, need to be continued. And during this time period, when you find that, especially for those who find that their medications are running out, it's important, it would be wise for them to get in touch with their clinic or the hospital or clinic as ever, on how and get advice, the appropriate advice on how to best refill their prescriptions. Now, the other issue remains as to what about NSAID medications. Neurosurgeons commonly prescribe their patients NSAID medications to help their patients deal with their pain levels, with their headaches, along with paracetamol. There have been reports recently, recent suggestions that NSAID medications can worsen the symptoms of COVID-19. Now these are particularly for patients with fevers, and that ibuprofen in particular can exacerbate COVID-19 symptoms. The majority of neurosurgery patients don't take these medications for the primary purpose of treating their fevers. It's for their pain. For these patients, along with NSAIDs, they're also prescribed with paracetamol, and it would be advisable instead to, in an attempt to manage their pain, that they resort to paracetamol instead. And for those who find that paracetamol isn't helping as much, they can add on their NSAIDs. Because we're dealing with pain here, we're not dealing with their fever symptoms, we're not dealing with their flu symptoms. So these are two take-home messages: that they continue with their anti-seizure medications, that they still can use paracetamol and add on their regular NSAID medications to help them with their pain. Their fevers, however, can be managed with paracetamol.
Okay. That's really useful information for those patients. And is there your final take-home message for these patients?
Yes, I think the final message over here for us, the members of the relation public, it's important for us to remain vigilant, to remain responsible, and place our public safety as the top on our priority. And along with this, it means to be conscientious about practicing social distancing, limit movements, restrict our movements, practice road safety outside. While you are on the road, if you have to be on the road, if you need to get to another place, while strictly adhering to the instructions by the Malaysian government and the Malaysian police. If you do need to go out there, be more vigilant. Do not present yourself with that chance, with that opportunity where you need to go to the hospital. Practice road safety even when there are no cars or traffic out there. These are the relevant things that we need to keep in mind and consider as we combat this viral outbreak together.
So thank you, Dr. Gerard, for this information. And that's all we have today for Your Daily Dose. Same time, same place, and different doctors. Thank you.